Pop quiz. A nurse is prioritizing care for 4 patients. Which patient should the nurse assess first? A patient with diabetic ketoacidosis whose blood glucose is 250. B, a patient with DVT who's receiving anticoagulation therapy. C, a patient with a wound infection who's receiving IV antibiotics. Or D, a patient with sepsis whose blood pressure is 88/50 and heart rate is 120. And guys, the correct answer is D. That's the person you're going to see first. Whenever you get a question about who you're going to see first, who are you going to prioritize, what the question is really asking you is who is most at risk of, and that's going to be that patient that's going through shock, that their organs are about to start failing if you don't do something soon. That patient with a blood pressure of 80/. First of all, guys, the minimum that your blood pressure should be is what? 90/60. This patient's blood pressure is 80/50, so we have hypoperfusion happening. And then look at the heart rate, 120. Let me tell you something. Whenever you are in big trouble, the two organs that usually respond first to try to help is going to be your heart and your lungs. Your respiratory rate will go up, your heart rate will go up. Why do you think that heart rate increased? Well, the patient is hypotensive. Organs are going to start failing any minute now. So now what the heart is going to do is going to try to compensate. It's going to try to push out oxygenated blood, minerals, nutrients, vitamins, everything that blood is carrying to your vital organs. So you're going to see that patient first. Now, after you see that patient first, the second patient you should see is that patient that's going through diabetic ketoacidosis. That's never a good thing, right? But when you look at the blood glucose, it's 250. Yes, it's high because your fasting blood glucose should be 7110. Yes, it's high, but not high enough to them as fast as the hypotensive state will, right? So you're going to see that patient who's in a hypotensive state first. Then you're going to go see that patient that's going through diabetic ketoacidosis. Matter of fact, let me tell you something. When the patient's going through diabetic ketoacidosis, we're trying to get that blood sugar down. But once we get that blood sugar down to about 250, we're still giving them insulin, but we're also giving them glucose at the same time. There's going to be dextrose in their IV. Why? Once we get that blood glucose down to 250, we're trying to slow the drop, because if their blood glucose keeps dropping so fast, they'll have a chance of going into seizures, right? And we want to avoid seizures. So when the patient has diabetic ketoacidosis, once it's down to 250, yes, they still get insulin, but they're also going to be getting glucose as well, so it doesn't drop too quickly. So hypotension, then the diabetic ketoacidosis, then you're going to go see B, that patient who has DVT and they're getting anticoagulation therapy. Nothing's wrong with them, but we're going to be assessing them first because DVT scan is also not as quickly as hypotension, not as quickly as that patient that's going through diabetic ketoacidosis, but there's still a chance. So that's the third patient you're going to see. And last, you're going to see that patient who has a wound infection that's getting antibiotics. It's a wound infection. It's not sepsis. It's not infection that went to their brain. It's a wound infection. So they're last on the list of who you're going to see. So guys, this is how you need to be thinking when you're looking at these questions and trying to figure out how to prioritize.